Well, anybody who's a grandparent knows that having the opportunity to see them grow up is the one wish that I think every grandparent has. And to know that I have that opportunity now as a result of my treatment at Lancaster General is just priceless. So I went for my mammogram, as I always do, and I usually go exactly at the 12 months if I can. But the pandemic kind of slowed me down, and I was about 3 months late. But as a result, and after going through ultrasound and a needle biopsy, I found out that I had cancer. I had triple-negative breast cancer. Generally a kind of a Pollyanna person. I'm optimistic and I'm pretty strong. But when they say the words cancer to you, that's a very emotionally packed word. The Ann B. Barshinger building is just like a warm hug. You walk in and it's an atmosphere and a culture of acceptance, of optimism, of hope. And then you meet the other part of the equation, that's the doctors and nurses and caregivers. Even the parking lot attendant is wonderful. He hugs me every time I go there. And it's just what you need at that time in your life. For my particular type of breast cancer, we determined that the best protocol would be chemotherapy first, then surgery, then radiation, and it worked out great. Well, I had the opportunity to do some genetic testing. A lot's been talked about the BRCA gene, and I wanted to know, did I carry that for my own daughter and for my granddaughter? Thankfully, I did not carry that gene. I had a great opportunity. I call it a little miracle, because 5 days before I started chemotherapy, the FDA approved an immunotherapy drug. So now I had a choice to make, and my oncologist said, you can go with the traditional protocol, or you can try this new protocol that is a lot longer. We feel it could be a game changer, but the decision is yours. And I said, I think I'm gonna stay with the traditional. And as I was walking out the door, I said to my nurse navigator, what would you do? And she said, that depends. Do you wanna live decades or years? And man, that just hit me. And I said, I want to give myself every opportunity I can to cure this thing. And so I went with the new plan, and I've never looked back. As a result of my treatment plan, I feel great. I'm back to my exercise plan, walking my dogs, and living life. I feel very hopeful with all the resources we have today for breast cancer particularly, and new ones coming out every day, it seems. I think you can be hopeful. I feel so fortunate living here in central Pennsylvania, and yet I have cutting-edge resources at Penn Medicine, Lancaster General Health.